Providers can help avoid getting caught up in government investigations, particularly those that involve subpoenas, by instituting a compliance program. Compliance programs deal with setting up standards so that a provider knows how to avoid regulatory pitfalls and how to deal with problems that come along if they suspect or know that they have violated a regulation. There are three main areas of a compliance program that most providers need to look out for. The first area that a provider needs to address in its compliance program is fraud and abuse. Fraud and abuse deals mainly with coding and billing and ensuring that the provider is billing every service at the proper level of service and that they are properly supporting all of their claims with documentation. The second area of a compliance program that providers need to deal with is corporate compliance. Corporate compliance is making sure that the business side of a practice complies with all of the state and government regulations that govern that particular type of practice. For instance, the corporate compliance program needs to ensure that a practice is set up in a business way that complies with regulations such as Stark, anti-kickback, and anti-markup. The corporate compliance portion of the compliance program also needs to address how the business employs independent contractors and mid-levels. If these staff are not properly employed through agreements, and if there are not policies and procedures set up to deal with how they are employed by the practice could be in violation of a regulation. The third major aspect of a compliance program that providers need to address is a HIPAA policy. In general, HIPAA describes how a provider must safeguard patient information and what a provider needs to do if that information is somehow disclosed to a third party or to the public. The best way to address it is to draft and implement a HIPAA manual. In that manual, all of a practice's employees can be educated on exactly how to safeguard patient information and exactly which steps need to be taken if that information is disclosed. If a HIPAA policy is put in place and a practice discovers that it has a problem, that it has improperly disclosed information, then the likelihood of a government investigation or any sort of penalty for that disclosure will be greatly lessened by complying with a properly instituted HIPAA policy.